All right. Hello, everyone, and welcome. Thank you for joining us today for our Herd Partnership webinar featuring Spruce Health. And I'm Melissa Klepp. I'm a member of the Customer Onboarding and Engagement team here at Herd, and I'm also a therapist myself. We are so excited to have the Spruce Health team here to lead this webinar for us today as they showcase their exceptional product offerings that can transform the way that you manage your mental health practice. And here at Herd, we are grateful to have a strong and valued relationship with Spruce Health, and together we have collaborated on webinars in the past. So we are very excited to kick things off here. And again, thanks for being here. And with that, I'm going to hand over to Michelle.
Thank you, Melissa. Hello, everyone. I'm Michelle. I am the manager of onboarding at Spruce Health, and I also am a former practice manager myself. So today we are going to think about some of the challenges that practice managers have, whether you are adding, new people to your practice of one for the first time, or if you are already managing a larger team. We'll think about training tools, task management, really creating message consistency, building a culture of transparency, and the importance of data. So, as a bit of housekeeping, this webinar is being recorded, and you'll have a link to that recording in the follow-up email that you'll receive. When you have questions, which I hope you're going to have lots of questions, please put them into the Q&A that you see at the bottom of your screen. So we'll talk questions at the end, but please just drop them in there as you think of them, and we'll try to handle as many of these as we can. So I'm very curious to see what kind of questions you have and how we can work through some of those together. So please don't hesitate to put in questions. As I said, this is me. I'm the manager of onboarding at Spruce Health and also a former practice manager. So as a practice manager, I worked for a larger mental health practice that had 25 clinicians and 15 administrative staff. So I was dealing with, a variety of different practice management challenges, and I'll definitely talk about some of my own experiences as we walk through this. Spruce was a very important piece of my toolkit as a practice manager. And since I'm now working at Spruce, I will, of course, be showing you some of the Spruce tools that I found useful. But I think we're really going to address practice management in a broader sense today as well. For those of you who might not be familiar with Spruce, Spruce is a healthcare communication platform that actually covers all of your different communication needs. So you're going to be able to handle your phone calls, voicemails, SMS text messaging, secure messaging, as well as video calling and internal messaging and fax, all within this one consolidated platform. So this can be an excellent tool for a lot of practices, both big and small. We have a lot of solo practitioners that use Spruce. We have a lot of very large practices that use Spruce. It's really a product that allows for a lot of customization and can help not just with practice management, but also, more generally with patient communication. So if anyone hasn't encountered Spruce yet and has questions about whether, this might be right for them, definitely drop those questions in. Happy to talk more about how practices use this as well. Okay, so the challenges of practice management. These are, to me, 5 of the big ones, and maybe you have other things in mind. Training is a huge piece of this. When you have new staff, being able to train them on all of your procedures, all of the different ways that your practice is operating is really incredibly challenging. So how each practice handles this is going to be dependent on you, what platforms you're using, how much you're structuring what each individual person is doing, or how much perhaps they're operating individually within your practice. You might, for example, have clinicians who are contractors and are sort of doing their own thing. Maybe you're a practice where everything has to be a lot more consistent. So you can definitely think about this in different ways, but training is definitely going to be a big piece of any practice manager's job. Consistent communication with patients. So, as your practice expands, being able to have communication be consistent becomes more and more challenging. You're going to have a bunch of different staff. They're different people. They typically communicate in different ways. How are you going to make that consistent? How can you, really structure communication so that your clients have a consistent experience? They aren't getting really different messaging from different people. So this is a piece that I think as you get bigger becomes more important. Task management. We all have this problem, right? That might just be for you. Maybe it's for managing all of your staff tasks, but have to have those tasks somewhere. And the writing it down on a Post-it note system only works so well when you have employees that you're also managing. So I would recommend moving past the Post-it at some point as you're expanding your practice and thinking about how you're going to assign tasks, how you're going to keep track of who has completed a task or has not, and where you're going to store that information. Transparency and an audit log. Somebody took your yogurt out of the refrigerator. You don't know who it was. How are we going to follow up and find out? So that as a example of what goes wrong in a practice might not be one that you can easily change with a tech stack, but you can have many different tech products that offer an audit log or some level of transparency, and you can think about how you're going to really utilize that to better manage your practice. Gathering and analyzing data. So for all of you who are using Herd, this is probably already an important part of how you're functioning, that you are looking at that financial data and thinking about how this can inform how your practice is running. Data is ultimately going to be essential to every decision that you're making in your practice. So being able to have relevant information to draw from and then knowing how to best use that information is a big piece of learning to be a better practice manager over time. All right, so first piece of this, training. How are we going to train our staff? There are many different ways you could be doing this. Maybe you have group supervision. I hope you do. I think that's a wonderful tool for clinicians. Maybe you have someone who, does kind of a ride along with someone else at the start of their training. They're shadowing someone, learning the ropes from another person. But I think often an issue can be really having somebody available to you to help you in the moment when you're first starting to learn. So in Spruce, we have this concept of an internal note. So when you're looking at communication with the patient, and in this case, here is the practice's view, and then here's the patient's view. So you'll see that this yellow bar here, this internal note, is only available to the practice. So this allows somebody at the practice to follow up after someone has interacted with a patient and say, hey, you did a great job on this, or hey, this is a different way you could have worded this for the patient. It also would allow that new person to first post something internally and ask for approval before actually sending it to the patient so that you can really scaffold those interactions. I think as far as training goes, being able to give people training wheels as they're going along really helps to ease them in so that you know that they're not going to cause any issues for your patients, that you're really going to be presenting a unified front as a practice, that the patients are always going to feel they get that consistent care. With clinicians, I know that you may often have trainees that you're supervising. And tools like this are incredibly useful for supervisors in terms of trainees because you're able to actually see your trainees' patient communication in real time. so that you can really easily jump in if something is going south, so that they can reach out to you for help if they need help with something. And I think whether you're using a tool like Spruce or you have other tools that work for your practice, I would think about how you can make sure that you have that supervision of communication and you are able to train those people by giving them consistent feedback on their work. All right. In terms of consistent patient communication, something else to keep in mind here is using some kind of templated response so that everyone in your practice is using the same language, so that patients, again, are getting that consistent language rather than hearing different things from different people. And again, this really helps with new staff because if they have a templated message to use, they're not reinventing the wheel. There are a lot of aspects of this as a practice manager that end up being important for your practice as it expands. One thing I've noted here is intake paperwork. So there are many different platforms that you can use to create custom forms. Spruce does not have the ability to create custom forms within it, but you are able to attach these to messages, and you can create saved messages that include attachments. So if you created a saved message that had intake paperwork attached, you could easily send that to new patients as they came in. Intake paperwork should be an important early project for any new practice. Every practice is going to have different questions that they want to ask with intake paperwork. And I think having that be customized in a way that is going to provide your practice with the most relevant information is really important. In the practice that I worked at previously, we actually treated a lot of very high acuity patients. So for us, an important aspect was finding out, had they been hospitalized in the past? How often had they been hospitalized? And what had their experiences been in those hospital environments? So very frequently, we treated people who had had really negative experiences with hospitalization, and this was an important aspect of their care for clinicians to be aware of, to understand that, they feared hospitalization, that this was something that had been problematic and not helpful for them in the past, and how care could be structured to allow them to feel safe, and that their clinicians would not push you into an inpatient environment if that wasn't really necessary. So intake paperwork is always going to be custom to the practice. And developing that should be an early step so that all of your clinicians have the information that they need to have. I've also noted here sharing practice policies. You need to have a place where these live. Maybe you use Google Drive and you have them live there. Maybe they live in Notion. Maybe they live on paper somewhere in your office. Whatever it is, though, it needs to be accessible and really clear and ideally searchable so that your new staff are able to come in, read that, understand it, and feel clear on those policies if they have to follow up at a different time. Again, when you're thinking about your tech stack, you need to make sure that each of the platforms that you're utilizing is additive for your practice. So I just mentioned something like Google Drive or Notion. Those might be things that would work well for you. They might not be. You would make really conscious decisions around this. I, of course, am biased, and I think that one of your platforms should definitely be Spruce, but that might not be the right communication platform for everyone. And I would, really think about how it might or might not fit for your individual practice. As I said here, these are saved messages in Spruce. So this is a way that you could create and send templates, maybe canned messages that you frequently use for how to submit a refill request. Hey, if you're submitting a refill request, please call your pharmacy first and make sure you don't already have that refill. This sort of thing. So this is a nice tool. It's a great efficiency tool for a lot of practices. One really great thing about this on Spruce is that you can use your saved messages with the mobile app, and you're able to then easily send attachments with the mobile app as a saved message. So I really love this. I find that a lot of clinicians really love this because it's something that they can do so easily in the mobile app, and they don't have to worry about, how do I attach a PDF to my message while I'm on mobile? I personally am perhaps too old to know how to do that. If I had to attach the PDF to the message in mobile, I might fail. But I can use a saved message that already has that attachment, and that works well for me. Task management. So this is really the key thing for practice management, in my opinion. You need to delegate tasks, and you need to be able to follow up and keep track of who has done what, who has not done what, when this is going to be done, due dates for these things. So there are a lot of pieces of task management, and there are a lot of platforms that people use for this. For most smaller practices, using an entirely different platform just for task management is not really that effective. It doesn't make sense. Often, a lot of money to be spending on something that you might not really need. So I would always recommend considering how the other tools you're using can really handle task management for you. So Spruce has a few ways that you can do this that I think are very effective. We have a concept called pages, which are sort of to-do items where you can send an internal notification to someone, letting them know, hey, you have this task to do. Supervisors are able to see all unresolved pages, so they have a way of really having oversight over how everyone is doing. You can also have teams that can be paged. So you could page the front desk team so that everyone on that team would see that. The other version of this we have in Spruce is called assignment, which is more like sorting pieces of mail. So you have all the communication come into one place, and then you can redirect pieces of communication to specific teams or teammates for them to handle. And supervisors are also able to see into those mailboxes so they can monitor what's going on there. I think when you're considering task management, one of the things to keep in mind is where is that task going to be accomplished? So I've worked with a number of practices that have some form of task management within their EMR. If the task is going to be accomplished in the EMR, I think this makes a lot of sense to keep it there. For example, if this was a refill request, and we're going to process that in the EMR, you don't want to have to switch between platforms. So if I'm a clinician and I go into my EMR and I see my task to submit a refill, and I go ahead and I submit that refill, I've stayed within that platform. That's a very efficient way of handling that task. But if the task is ask the patient, answer the patient's question about this medication, that might not be something you're doing within the EMR. You might be doing that within a different communication system. And it's helpful to have that task then live within that communication system. So Spruce really allows for these great ways of doing that so that, again, you can keep that task in the place where it matters. I think the hardest thing for practices is when task management becomes spread throughout multiple platforms and people feel like they need to look for their to-do items in a lot of different places. So it's important as the practice manager to think through, where is everyone going to look for their work? When I train a new person, where do I tell them to look for their work? What platform are they typically living in? If you can make that one platform, that's probably ideal for most people. If it's two platforms, maybe that's fine as long as they understand what to look for in each of those platforms. When it becomes more than that, we really have a problem. You don't want to do it. Probably all of those platforms are not really needed for your practice, and you're going to end up with a situation where things are just forgotten. It's also a lot harder for you as a supervisor to be able to tell people, oh, you didn't do this, you didn't do this, if you have to monitor things spread in all of those platforms too. You also want to make sure you have a way of having oversight with these different platforms. So Spruce really allows for a lot of oversight. This is true of many other platforms as well. But if you are starting a practice, especially, and you're thinking about building out your tech stack, this is something to keep in mind. Not just how can I assign people tasks, but also, am I going to be able to supervise whether or not they completed those tasks? Just to show this a bit in Spruce, this is called page oversight in Spruce. So here we can see everyone's unresolved pages, their unresolved tasks. I would also be able to filter this by team or teammate to look for, how Mary or Joe was specifically doing, find their specific list of pages. So this is it's a great tool. I love this. This was so important to me as a practice manager to have the ability to see pages. I think for my front desk team in particular, this was something I kept track of on a daily basis. They've been tasked with all of these different things, all of these follow-ups for different patients who are coming in. Have they done them? Are we behind? You're also able to see with pages who's resolved something. So if an entire team is paged, like the front desk team, I can see, oh, Julie is the one who resolved this page. If I start seeing, oh, hey, Julie is the only one who's resolving front desk pages, this is important for me to understand as a manager, to come in and say, hey, what are, Fred and Sally doing all day? Julie's resolving all the pages. So just having that oversight into what they're doing, really gives you information that's very important and useful as you're going along. All right. This is just showing the concept of assignment in Spruce. So in Spruce, you're going to have an inbox that has an all box, which is everything that's unassigned. This is where, all of your mail is being dumped, your big pile of communication. And then beneath that, we're seeing things that are assigned to you individually. Like this is your mailbox, things that we moved into your mailbox. Supervisors might have an assigned filter where they're seeing anything that's assigned to anyone so that they can keep an eye on that and notice like, oh, Julie has all these things assigned to her that it doesn't look like she's taking care of. You'll also see that there's an assigned to clinical team filter here because this user is on the clinical team. So this is the clinical team's mailbox so that I can put things there for that whole team to be able to work on. So organizing your inbox, is a big part of setting up Spruce. As the manager of onboarding at Spruce, this is something I work with a lot of practices on to think about how they want to be able to sort communication, how much visibility they want everyone to have, which things they might want to have segmented out. And for supervisors, thinking about how they can have more overarching visibility and also at the same time be able to delegate effectively. So delegating tasks is really hard. I think it's especially hard when you're used to kind of doing everything yourself, which I imagine a lot of you are if you, perhaps started as a solo and are now expanding your practice. That's something that we see a lot at Spruce of people coming in and then adding employees later and, having to really make adjustments to how they're working if they are going to delegate tasks. I think that if you're able to delegate the task, but also really feel that you can continue to supervise that person and have visibility into that task, it's much easier to walk away and let the other person take care of it. You want to still have the visibility. Even if you basically trust the employee, it's nice to feel like you know what's going on. So you want to make sure that the products that you're using still allow you to do that. Which gets me to transparency. Transparency in Spruce is something that I think is just an incredibly powerful part of the platform. The audit log in Spruce is just very obvious and really, just there for you without needing to dig into anything. You can see right in a conversation that there'll be a system event that will show any action that was taken, such as archiving the conversation. You'll also see that in message details, you're able to view which person has seen this communication and when. So this is a great way to be able to follow up with an employee. Maybe, you look at a place where you've paged them and you see that they haven't even seen that page yet. And you can reach out and say like, hey, Dave, are you not looking at Spruce? Seems like you aren't viewing any of your messages. What's going on? So just having this level of transparency is great. As a practice manager, I definitely had situations where employees would say, oh, I didn't do that task because, I didn't see it. And I can come right into Spruce and tell you exactly when you saw it. So once the employee realizes that that's true, it does shift things a little bit, that they understand that they need to be honest with you about this because the platform is so transparent that they're not going to be able to just say they didn't see it. I love this as a tool. I do really think that it's nice to have that sort of honesty easily built into the platform. So something that's worth looking at. From a clinical perspective, this is also nice in terms of liability. As I said before, we worked with very high acuity clients. If your patient reached out with a suicidal message and unfortunately, something did happen, it would be possible for you to also show your malpractice insurance exactly when you viewed that message. If you didn't view it until 6 hours later, that shows up there. You can clearly see that that's true. If you viewed it earlier and didn't take any action, that's also true. If you have a supervisor and you page the supervisor for help and they didn't view it until later, that's also going to be visible. So just having that audit log can offer you a lot of protection and really have that, level of clarity into everything in your practice. All right. Data management. So you need to have data. Probably all of you know this because a lot of you are using Herd and you're using their data tools to learn more about your practice and think about how to manage it better. So I'm probably preaching to the choir on this one. Data is just incredibly important for being able to make any decisions about how your practice is running. This would be true for any business. One of, the strengths of a grocery store is whether or not they can keep track of their inventory and how fast they're selling those boxes of Cheerios and getting Cheerios in stock at the right time without having too many Cheerios. So this is something that you're doing with your practice for everything from, restocking toner in your printer to making sure that you're hiring the right number of people to handle the number of patients who are coming through intake. So there are a lot of kinds of data that you need to be monitoring in practice management. And again, it's going to be important to think about what platforms you're using to manage this and where that information is being stored, how you're gathering that information. Spruce is a tool that can offer some degree of reporting. So this is one report that Spruce can run where it's showing calls and the time of day that those calls were received. We call this a heat map. So you can easily see at a glance, oh, we got the most calls at 5 p.m. on Tuesday. Why? I don't know. I would probably want to compare multiple weeks to be able to say, hey, is that typical? Are Tuesdays a super big day? Or was this just, hey, that random Tuesday, lots of people called at that time? If you had a phone tree with Spruce, you would also be able to break down how many calls chose a given option on that phone tree. So for example, if you had a new patient option, maybe you could say that, all 14 of those calls were people who chose that new patient option. That's really important to know. For some reason, there are a lot of people who are reaching out at that time about becoming a new patient. If you were seeing a lot of calls coming in on the weekend, you might want to consider hiring someone to take those calls. Or you might want to consider making changes to a phone tree so that those calls were being routed in a different way, or you were able to capture where, what those callers needed in a different way. So having data to draw from, is important, but you also need to be able to analyze it to make those decisions. So you need to make sure that the way it's presented to you, the way you're working with it is helpful to you. I happen to love this particular chart because I find it so easy visually to just have a sense of like, oh, these are busier times of day. I could think about staffing differently based upon these times of day. One of the other charts that we can create for you breaks down who is taking calls and how long they're on the phone. So I definitely had issues with my front desk workers because I would have 3 who were working at different locations at the same time. And I could see in the data that like one of them was answering calls and the other 2 were not. So I know those calls are ringing to all 3 of you simultaneously. Why is only one person answering any of the calls? And this is something I was able to work out by making changes in the phone tree where I had calls routing to one of the locations that wasn't as busy so that that person could be mainly responsible for calls. And I didn't have to be concerned about, which person was just answering first because they were, quicker on the draw or perhaps a bit more responsible. But I could really push those calls to the person who was best equipped to answer them because they had fewer patients who were coming in the door during that time period. So a lot of different ways that, having this information can be really helpful in thinking about how you want to make staffing decisions and how you, just want to structure your practice in general. All right. I know I'm going a little fast, and I am hoping that there are questions for me to work through so we can also circle back, to earlier slides if there's something in particular that we want to dig into more.
That's awesome, Michelle. This is Carrie talking from Spruce. I don't have my video on because I am just here in an assisting manner to field some questions. So now is your time, folks. I have a couple of questions lined up, but I know you've probably got more because Michelle covered so much good stuff. Let me start with one that came in from Candace, Michelle. And she's asking, what are rules and regulations surrounding using Spruce to automate requests for reviews following an appointment or a certain number of care touch points?
To automate requests for reviews. So it sounds like, and maybe correct me if I'm wrong here, it sounds like what you're wondering is after a client has reached out a certain number of times, is there a way to automate some kind of response or ping someone for a task in response to them having gone through this number of care touch points? Spruce allows for a number of forms of automation. Right now, I can't say that I could create a workflow that specifically was like, hey, they've sent 5 messages, so we're sending them this. It's not going to do that. You can certainly set up auto replies. You can schedule messages. So you could say, after this person has an appointment. I've scheduled a message to send to them saying XYZ. You can schedule internal messages. So I could schedule a message with a page to myself saying, check in and see what this person needs next. So there are certainly ways that you can structure communication like that. I'm not sure if that answers the question, or if there's something different that you're trying to achieve there.
Yeah, I think that's a great answer, Michelle. Just kind of honing in on the automation function. One thing I was thinking Candace might be thinking, and Candace, feel free to weigh in or put a follow-up question. But I was on a phone call with a pediatrician the other day, and he was saying that he uses Spruce to garner reviews, like Google reviews for his practice. So I would imagine you could probably use like our bulk messaging feature too, if you wanted to just send out, something to all of your clients and or patients saying, hey, if you're enjoying your service with me, would love to hear about it on, okay, yeah, that's what she was wondering, asking for reviews. Yeah. So for sure, doctors are doing that. In fact, I had reached out to this doctor to say, hey, would you be willing to give us a review? And he said, yeah, funny enough, I use Spruce to solicit reviews from my patients. So yes, you can certainly do that. And I mean, yeah, I'm thinking bulk messaging, but you could probably set it up to be automated on a case by case as well.
Yeah, and I would say also with the bulk messaging feature, you can really use Spruce as a CRM type program if it's something that you're doing, by using tags, because you can add tags to a group of people and send bulk messages to that group. So one thing that I suggest for people who are setting up phone trees, different kinds of call flows in Spruce, is to actually have it automatically add like a prospective tag to anyone who is choosing that option, because you then end up with, a whole list of numbers that have that prospective tag on them in your contacts, and you can easily follow up with those people in bulk. So I really like that as a functionality to be able to group people out and follow up with them that way. And I think you can certainly do similar things with existing patients in terms of, oh, they've had this many appointments. You could tag someone with, a number of appointments, something like that, to be able to set up those groups. Nice thing about bulk messages as well is that you can schedule them. And you can schedule them to send to anyone with a certain tag, and it will send to whoever has that tag at the time that it is scheduled to send. So if you've added 20 different people between the time you created it and the time it's scheduled to send, those 20 people would also get that message.
Awesome. That is very cool. Thank you, Michelle. We did get something in from Karen just as you were starting today's session. She's saying she is interested in what you were sharing about Spruce, and that she's currently with Simple Practice as an EHR and researching, other platforms as well. This might be a nice segue into how Spruce plays well with other parts of people's tech stack. Is that something you want to speak to?
For sure. So I want to say up front, I used Simple Practice among a number of different EHRs as a practice manager. Simple Practice is, I think, very well suited for a lot of therapists, because it really has like a fairly simple note-taking function that can just be really nice when you are a therapist rather than dealing with medical questions. My practice actually had both psychiatrists and therapists, and we ended up shifting to Elation because Elation has an e-prescribe function, which Simple Practice does not. And that was really important for the psychiatrist to be able to have natively within the EMR. All this to say that for every individual practice, finding the EMR that works best for you is going to be a whole thing. There are way too many of them, and I have never found one that I like all that much. So I think you have to find the one that has the features that are most important for you. I know that a lot of them now have various communication features that are built into them. Simple Practice has a messaging feature, Elation has a portal. I think honestly, most EMRs have some kind of communication portal. A lot of them also have Zoom or a different kind of video built into them so that you can more easily do that for virtual appointments. I think something like Spruce is very additive, because not just because it's providing your phone system, which most EMRs do not, but also because the Spruce secure messaging is often a lot easier for patients to use than EMR portals. Many EMR portals are not great. And again, I'm biased, but I think that the Spruce app is often a lot easier for patients. One of the things that makes Spruce really nice as a form of documentation is that it's really easy to copy and paste messages from Spruce directly into the EMR. It pastes in as plain text in a really nice way, so you can just use that as documentation. If you've already had this whole exchange with someone, it doesn't really make sense to summarize that in the chart when you could really easily just put the whole thing into the chart. So we have a native integration with Elation and also with Hint. We're working on building an integration with Athena right now. So for those that we have an integration with, you're able to more easily just sync that message into the patient's chart instead of copy and pasting it. But I honestly think the copy pasting function is simple enough that it makes Spruce really workable with any EMR. I would also say that the ability to copy paste voicemail transcripts is amazing. Just being able to have that voicemail transcribed and then just have that text in the chart is so nice as a piece of clinical documentation, instead of having that be a voicemail that's just like a piece of audio that lives totally separately from the chart, and you don't have that evidence like very clearly in there. So in terms of documentation, Spruce is hugely additive and I think connects really well with any EMR. The other piece is always getting your contacts from your EMR into Spruce, and different EMRs do that differently. Again, if you're dealing with one that we have an integration with, that's going to happen in a more seamless way. We also have a public API. So if you're somebody who wants to actually build something to your EMR and tackle that on your own, there's also a lot that you can do there. Simple Practice, just if you are using it and you end up using Spruce, Simple Practice is going to dump out all your contacts as a VCF file, and you're going to make it into a CSV. And if you have trouble, I'll tell you how to do it. We go through that with a lot of people. We have a lot of Simple Practice users.
That's awesome, Michelle. Thank you. Candace did follow up and ask for a platform that doesn't already integrate with Spruce, like sessions, for instance. Is there a way to get them to talk to each other, or should I just use copy and paste? I'm thinking of sending documents from sessions, but not sure if it's worth it if they don't talk to each other.
Yeah, so I think if you're looking to send documents from session, it somewhat depends on how that platform would be sending the documents and what's going to be best for your patients. And I think also, like, what are they needing to do with those documents when they receive them? So if Sessions has the ability to let them, for example, sign that document as part of the platform, that's something that Spruce doesn't do right now. And so sending it through Spruce might be harder for the patient because they're going to have to download it, they're going to have to sign it, they're going to have to send it back. It's not possible within Spruce. If you're talking more about, how do I move, documents from one place to another or keep them on their chart in one way or another, certainly, like, I think Spruce can talk to an EMR fairly well in that respect. One thing that you can do with Spruce that I actually really like is you can copy a message link and put that somewhere else. And if you are signed into Spruce, you can click on that. It will open it in Spruce. But this is really nice if you have to send information to someone else and you don't want to send the actual PHI, if they're part of your Spruce organization, they would be able to click on that link and it takes them right to that spot in Spruce. So just a nice thing to do. You can also include those links in the chart so that you can refer back to Spruce really easily yourself if you don't want to necessarily copy paste the whole exchange in there.
Excellent. Very thorough answer. Thanks, Michelle. A few minutes earlier, Beth had written in and asked if bulk messaging is just available with the communicator plan.
Yes, that's correct. Bulk messaging is part of the communicator plan. Our basic plan includes all of the Spruce functionality that I think tends to be needed for most solo providers. I find that a lot of times as a practice grows, they want the communicator plan for a number of reasons. One of those will be setting things on a schedule, like having a daytime phone tree and a nighttime phone tree. Another thing might be just having more automation that's built in that's only possible with Communicator. The reason the bulk messaging is only possible with Communicator is really about cost being carried by Spruce when you are sending those larger numbers of messages.
Perfect. Perfect. I love it. Okay, so we got through the questions that came in already, but there are still a number of people on the call. If anyone has a question of Michelle, the time is now, because you may not always get this kind of personal attention. So I encourage you to drop them in. Otherwise, we might just have to give you a few minutes back. So I'll give you all a couple of seconds if there's anything you want to drop into the Q&A. Otherwise, let's see. I think we have a couple of link outs on the next slide, ways that you can learn more about Spruce. Yep, primary website. We've got our blog and we've got our help center. If you want to learn a little bit more about Spruce, there is a demo feature on the main website that you can check out. And of course, you can always reach out to a member of our team if you have further questions. Let's see, did something come in? Okay, well, question from Megan came in. She said, sorry if I missed it, but can the Spruce number be used on therapists' cell phones?
Yes, absolutely. So you can choose to use any existing number within Spruce. So if right now you have a Google Voice number or a RingRx number or, a phone.com number or whatever carrier you currently have, you can transfer that number into Spruce and it becomes a Spruce number and you can make and receive calls on your cell phone through Spruce. You can also ask us for a new number. So if you're starting a new practice and you want a new number, you can get a new number. Definitely think about, what might or might not make sense for you there. If your patients already have your number, you would probably want that to become a Spruce number so that they could continue to use it and you would see that communication in Spruce. I think that we play really, really well on mobile. I think the mobile app is great. I think a lot of providers almost entirely use this on their phone. I did have someone in a meeting recently and I shared the browser version of Spruce and they said, what is that? I've never seen that before. I said, oh, this is how it looks on the computer. And they just shell shocked, like, on a computer? So I think some people really just use it on the phone, but it's great in both respects. It's also really like a complete system. So if you are a practice that wants to have desk phones, we also offer desk phones, and those phones are fully incorporated into the system. So if you're making and receiving calls on the desk phone, that also is going to show up in your Spruce interface. So I think that can be really nice if that's important for your practice. I know for me, like all of my front desk people had desk phones because there was no way I was going to have them all sitting there on their cell phones all day. Not a good look, but also I don't need to encourage them to be, playing Candy Crush while they're supposed to be working. So ideally would like them to have a desk phone. So you can certainly do that. We actually are going to be offering desktop-based calling, probably in the fairly near future. So we're excited about that, especially for our customers who are using international VAs and have been asking for that for a while.
Great call out. That is true. That's going to be an exciting feature. Good. Well, I think we tackled it and we got through so much good content. So a giant thanks to Michelle. I always learn new things on these webinars, so I love that. Thank you again to Melissa and to Herd for hosting us. And do keep your eyes peeled for that email that I'll be sending out in the next couple of hours with a link to the recording and some helpful resources. Anything else? By all means, reach out to our team. We're grateful to have had your time today and look forward to future webinars together.
I do want to call out before everyone leaves today that Spruce does offer a 2-week free trial. And, I always recommend trying it yourself. Go in there, set it up, play around. I offer training sessions that are open to all customers 5 days a week. I would love to see any of you, and you can let me know that you are here and you're looking to definitely know more about using Spruce for practice management. I would be excited to see you. So please, consider just playing around with it too. I think everyone learns more through doing.
Great call out, Michelle. Thank you. Thanks, everyone. Have a terrific day.